Hello again. My name is Yunche Wilson, guest correspondent here at MedEdge MEA, and we're here at the Critical Congress Care Conference in Abu Dhabi. And I have with me the esteemed Dr. Ahmed Taha, who is the assistant professor at the Cleveland Clinic Lerner College, also a cardiac intensivist at the Cleveland Clinic in Abu Dhabi, and finally the co-chair of SCCM. How are you today, sir?
I'm fine. Thank you so much for the interview.
You are very busy, so I'm very grateful to that you're spending time here with us on the couch today.
Thank you so much for coming and so happy to discuss today's work.
Absolutely. So let's dive right in. But tell me about the last talk that you just delivered.
We have today a big sessions about the fluid management in ICU, especially the use of the fluids. We are insisted in the speech through the big number of speakers to emphasize that fluids is a drug and keep every one of our team and attendees understand that the drug needs a dose and a route and the time to give. So once you want to prescribe fluids, you need to understand why you prescribe fluids. I'm happy with the interactions during the session with me and the rest of the speakers. A lot of questions makes us happy that the idea we want to deliver is already reaching them. And this is a change of practice concepts. We need to change the practice of giving liberal fluids to the patient because really in all ICUs, this has a bad outcome for our patients and increase hospital stay and also economic burden. That's why this session I expect to have a good practice changes in the team's attendance.
So tell me some of the things you're most excited about as far as advancements in the particular field that you're in.
We really, there is a lot of advancement of critical care every day, and we currently changing the critical care concepts according to the scenarios that we are dealt with, and according to the continuous research internationally. Our field is dynamic, and the changes is every day, and every day we have a new items in critical care and a new concepts needs to be emphasized. That's why I feel the presence of such programs for education to the intensivist, education to the resident and also the fellows, it's very important. It helps much for them to get the new concepts. Today, one of the amazing sessions is talking about the detection of the difference between the sepsis and the systemic inflammation. And this is a big issue. That's what you don't know. You should use antibiotics or there's just an inflammation in the body. And to make it simply, that this is presented today with Dr. Tamas Zazamanki. And Dr. Tamas, he has a patent in this from US, and he give us a big hope that managing with antibiotics in ICUs can be changed with the new biomarkers they go through. So I feel this is one of the things considered unique to our conference, and I'm so happy that this inventions is going on. All our aim and thinking that we need this to be practiced and it becomes available in the market. So in the next maybe 1 or 2 years, it becomes something easy that we can use inside ours here.
That is wonderful. And as co-chair of such an amazing conference, I imagine you've got to be excited to see the turnout and how people are responding. What makes this conference different from some of the others?
Really, we are honored to be licensed from Society of Critical Medicine of USA for this program. The things in this conference, all our talks is coming, the best talks selected from the Society of Critical Care Medicine conference. And most of these talks is based on research. So we are here to present the best of the best that's happened in the last year. And we are taking the license from Society of Critical Care Medicine and endorse it also with the society to be presenting this program in the Middle East. It's very good for our colleagues in the Middle East to attend because maybe they are not able to travel to US, maybe for the expenses, the time, and they are engaged. So there is a big chance for them to join us, to listen to the same talks, to have the same discussions. We have big number of the SCCM original speakers to give their own talks in addition to our international speakers and local speakers who is giving also the talks and chairing the sessions.
That's wonderful. It's absolutely wonderful. Do you have any final thoughts, any last things you want to share with us before we close?
Yeah, I wanted to share this conference. This is the fourth version of the conference. We started the Best of SCCM conference in 2019. We stopped the conference sometimes because of the COVID, but we had in the 2021 another conference which is virtual due to the COVID was still there. But since 2023, we started regularly to run the program. We run 2023, 2024. I hope we have a bigger conference in 2025. I feel this is a good chance for all the Middle East critical care physician to share. This is the first time for our conference to have abstract submission, and I'm working on the abstract submission to be one of the big items in our next conferences. So we have all chances to our colleagues from researcher to share with us their research, discuss the research with the jury from SCCM.
That's beautiful. Innovative technologies, new ideas, all together in one place to make critical care a frontier of everything that's happening in your landscape.
I'm really thankful for the interview, and I hope to be this platform of the Best of SCCM to be attractive to my colleagues in critical care across the Middle East and help them to improve and upskill their knowledge every year.
That's wonderful. Well, thank you so much for joining.
Thank you. Thank you. Thank you. It's my pleasure.